At the Peace Pantry in West Jefferson County, people receive canned goods, boxed food, and important healthcare services from public health nurses. President Linda Schrader explains.
Last month, they were here, and we had a client, an older gentleman, and he wasn't feeling well. And so he went to the van, and the ladies there talked to him and assessed him and took his blood pressure and told him what he should do. And at that time, I didn't know it, but they had told him, if you get worse, you need to go straight to the emergency room. Well, that evening, he was not feeling better. He went to the emergency room, and he was actually having a stroke. So they actually saved his life.
Saving lives isn't a normal daily practice for the staff at the Jefferson County Health Department. Their work is typically focused more on treating entire populations and creating healthy environments where everyone can live a healthier life. Administrator Kelly Vollmer explains.
Public health is about creating entire healthy environments. So we're not looking at just an individual like a doctor treating an individual. We are actually treating entire populations. We're helping them to develop healthy behaviors. We're creating healthy environments, and we are looking at ways to engage people in healthy behaviors that will make a difference not only for themselves but for generations to come.
And their approach is working.
We have one client that the health department worked with her, and she comes here every day, and she walks, and she's lost over 100 pounds. So, those are the kind of success stories that we're seeing here, and it's all because of partnering.
Vollmer says partnerships with the Peace Pantry and other organizations are essential, especially for reaching people who have transportation challenges.
All the western portion of our county, and especially southwest, really lacks access to medical care, access to a lot of services in terms of food deserts and other things. And so what we try to do with our programs is to look at how do we manage to take care to those actual areas.
The health department operates a mobile dental unit and a mobile wellness van that deliver important public health services to rural communities. Program Coordinator Deborah Moore says the mobile units set up in different parts of the county and try to hit the most vulnerable populations where people may not have transportation to drive to the health department. But, she says, they try to serve everyone.
We see a variety of individuals with and without insurance. We never know who's going to call or knock on our door. We try not to turn anyone away for any reason at all, whether it's financial issues or whatever it may be. We try to help everyone we can in the community. That's what we're out here for.
Today, the mobile unit is parked at Sunny Hill Independence Center, a residential facility that serves people with developmental disabilities.
The old ticker still working?
Moore says bringing services on site to locations like Sunny Hill and the Peace Pantry lowers healthcare costs and saves time for customers and their caregivers. She says partnerships like these are vital. They provide a way for the health department to reach people who have put their own healthcare needs aside, often because they have no health insurance.
We've seen people there that have not seen a doctor in over 10 years. So we've ended up treating a lot of people for chronic illnesses that needed to be addressed, and they've become regular patients of ours, and it's a good feeling knowing that we're helping them.
Schrader has volunteered at the Peace Pantry for years and says the health department's mobile van is important and appreciated by food pantry's staff and guests.
The health department has been great for this pantry, and one of the things that I hear from our guests all the time is they like that the van comes here, because a lot of times they don't have the gas money to drive to Festus, to drive to the local hospital. And then it's also a friendly face that they see once a month, so they get used to seeing that person, so they feel more comfortable discussing their health issues with a person that they see all the time.
The Peace Pantry wasn't selected at random. Back at the health department, Vollmer says strategic planning for where to place the mobile vans and which services to provide is anchored by Missouri's foundational public health services model. The model identifies foundational capabilities and public health areas of expertise that must be assured in every community in order for the entire public health system to function effectively.
So when we look at our wellness services and our mobile health services, we're looking at doing assessments of our community, and not only looking at the county as a whole, but trying to get down to zip code level or our community levels and find out where are areas of greatest need and what is the greatest need.
She says needs vary widely from one community to the next, from access to medical care, to chronic disease management, to education on how to utilize the healthcare system. Partnerships with churches, schools, and organizations like Sunny Hill and the Peace Pantry are key to successfully reaching vulnerable populations with the public health services they need most. And Schrader agrees.
If you don't have these partnerships and these different agencies that these people can get into right away, they have no hope. They don't want to hear that they have to wait 3 months for an appointment, or, because typically they wait till they just can't stand it any longer before they ask for help.
She'd like to see more funding for public health to meet the needs in rural Jefferson County.
I would say my biggest hurdle is getting the state to realize that the need is just not in the cities. The need is in the rural areas. We have real problems in the rural areas. This area here is one of the poorest areas in Jefferson County. We need a lot of things. We need transitional housing. We need these people from the health department. Instead of being able to come once a month, I'd love to see them have the funding to come once a week. That's what we need.
Schrader says lives could be changed if all partners would work together to address community needs like the health department does.
People don't realize how important that is for people that they can't afford it. They can't afford just to, run up to the emergency room. So these ladies and men being here, even to give them their COVID shots, it's life-changing. People don't think it's life-changing, but it is. It truly is. And if we could get all of the agencies to do this, we've changed lives. And that's the most important thing.